thoracic surgeon is basically a chest surgeon who is dealing with the intricacies of the chest. That includes lung lining, that is called pleura, and the structure in between the two lungs, that is the area above the heart, is called the mediastinum, जिसमें we have airway and esophagus. So food pipe and airway pipe, these are the chest wall. Trauma is handled by a thoracic surgeon in the areas of the chest. So this is the complete specialty in itself, which is covering the whole chest area. So the commonest symptoms when you want to see doctor of thoracic surgery is when you have recurrent cough which is not settling down, or along with there is a blood coming out of the chest, or there is a chest pain, breathlessness, and there is any trauma related to the chest or lung cancers, any infections or a pus accumulated inside the chest wall. That means there is a effusion inside. So for diagnostics as well as treatment, you deal with chest surgeon. So as we say, it is a major surgery, yes. The reason behind is because we are dealing with one of the most vital organs of the body, that is lungs. So it is supporting our respiratory system and it works along with the heart. So definitely it has a major role, and that's why it is called a major surgery, and we are dealing with all the important vitals. So when the question is asked about is it only open surgery, so we cannot say that it's only open surgery. Now we have advanced, evolved, and now minimal invasive techniques have come up, like video assisted thoracoscopic surgery, robotic surgery, so which is helping both the patient and the surgeons for doing a very efficient and a good surgical work. So how it happens to be very good for the patient is it is less invasive. In that way, the wounds, the cuts are smaller than the open wounds. So it is definitely less pain bearing, and the patient's recovery is faster than expected from the open surgery. So the evolution of surgery has taken place from open surgery to minimal invasive to robotics, and now we are moving ahead with a lot of more advancements, like single port means one small opening, and we are operating with that. So almost every surgery carries certain amount of risk. So it is dependent upon the patient, anesthetic risk and certain surgical risk. So we cannot just say that thoracic surgeries involve more risk or certain risk. Every surgery has a risk. And when it comes to thoracic surgery, so all the parameters are calculated before operating a patient. So that's how we quantify and qualify that these patients are on a risk, high risk, low risk, moderate risk. Thank you.